In this video, we discuss whether or not private practice is on its way out. Hi, my name is Liz. Don't forget to hit the like button and subscribe to my channel so you get notifications of future content. In 2012, 60% of doctors worked in wholly owned physician practices. In 2022, that number has dropped to 46.7%. The statistics would seem to indicate that private medical practices are on the decline. Before 2020 hit, there was a moderate number of healthcare workers coming out and talking about the ever-increasing challenges in the medical field, caused by many different factors, such as increased paperwork, increased demands made by insurance, more red tape, an increasing nursing shortage, burned out doctors, and suicide among healthcare workers was all on the rise. In 2020, the entire world, including patients, felt those challenges on a personal level. I saw things become national news that previously had only been known by medical care workers. The issues went from bad to worse, and in case you are wondering, they still aren't being addressed. So what am I seeing that makes me think that private practice is actually on the rise? Let's talk a little bit. So let's look at it from a patient standpoint. All the paperwork associated with care has gone up, and patients are growing tired of practitioners staring at a screen to complete required documents rather than taking the time to interact with their patients as humans. As far as the medical workers side, most of us got into the field to help patients and be there when no one else can. What so many don't realize is the way the hospitals, long-term care facilities, and clinics get paid is through documentation of the visits and care, as you will find out quickly in healthcare. Unless you document it, it did not get done or reimbursed. So there is a lot of documentation that goes into all of healthcare. All right, and then number 2 is insurance. With patients, often they want different treatment plans, right? So maybe they don't want to go with the option that 75% of other patients are going with or deciding on. They want, what 25% of people are going with as far as treatment goes. And honestly, if it's not part of that 75, insurance a lot of times won't even reimburse or won't approve it. That's why we hear a lot about pre-approvals in medical care. So of course, that's incredibly frustrating for patients. They pay a lot of money for good insurance only to have the insurance companies deny their claims. As far as for medical practices or medical workers, oftentimes it's the nurses and office staff that call insurance companies to get those pre-authorizations. This can take several communications, not just one, sometimes up to 10 or 12, and it's not always approved. Then the care team is forced to come up with an alternative treatment and resubmit to insurance. Insurance also often caps what they will pay for all treatments, causing further issues. We're going to look at red tape. Whether it is a hospital stay, clinic visit, long-term care, admission, or any other major medical event, the sheer number of regulations and requirements are ever increasing and even more difficult to understand and get through as a patient than ever before. It has been my role most of my life to help and take care of people in the elderly population. And I have done a lot of that for people in their elderly years. Help them try to understand insurance. Help them try to understand what they need to do, who they need to call, what HIPAA is, all of that. Because as a patient, most of the time people don't understand that. Or maybe they don't understand why their husband can't call and get information if he's not on HIPAA-approved paperwork. Different things like that. So of course that's incredibly frustrating for someone that's already likely dealing with a lot of illness. Then they have to deal with the insurance companies. It's also the same for us medical professionals. According to Brexy, 1 in 5 American adults has experienced a medical error. In turn, medical malpractice is on the rise. Medical professionals are feeling the squeeze and increased laws being passed, government regulations increasing, and increased scrutiny by the public. So one of the reasons that red tape is on the rise is because medical malpractice is on the rise. There are more and more errors. And what will happen is a new precedent will be set by an issue that happened. They'll take it to court, then a new precedent is set, and then every year those new precedents are then turned into new regulations that then are passed down to clinics, long-term care facilities, hospitals, all of that. So that's one of the ways that the red tape continues to increase. which again can be incredibly frustrating for me as a nurse, because really all I want to do is help you, help your father, help your mother, help your child. Now let's talk about nurses a little bit, because this is a serious issue right now. Patients' best advocates have always been nurses. Nurses have in the past been among the most honored of professions, along with physicians, are leaving the field in droves. That's actually one of the reasons that I stepped away for a little while. They are tired of the increase in work, unsafe patient ratios, and increase in patient violence, increase in legal cases against them. The list goes on. One thing that has changed a lot since even I exited not that long ago is there's an increase in patients actually bringing lawsuits against nurses for medication errors and different things like that. So as a nurse, another thing most people don't understand is when you have a license as a nurse, when you earn that license and you go and you pass those boards, that's a physical piece of property that we own. It's ours. We earned it, and we own that. We own that licensure. And a board of nursing or anyone else cannot just go and take away your licensure. They have to go through a process in order to do that. So it's increasing the anxiety in nurses and other staff, because they have that to protect that they work so hard for. And so they're more likely to hopefully be better at documenting and doing all those things as well. Now on the nursing side, there's a huge nursing shortage. So due to all the above issues, many nurses are leaving the bedside, just like I did. This means more patients for fewer nurses. More and more lawsuits are being brought against nurses. Nurses are giving so much responsibility with little power to change things for the good. The other thing that most people don't realize is that nurses are almost always smack dab in the middle, or considered a middle management. We usually have CNAs under us, medics under us, and different things like that. And then we've got a director of nursing above us. And then we have doctors and the directors and different things like that above us. So we're like smack dab in the middle, trying to help and make the patients happy, as well as all the people that we are working with. So it can be an incredibly frustrating experience. Now let's move on to doctors. So from patients' standpoint, patients are now questioning doctors who used to be revered and respected at every turn. Medical malpractice suits are on the rise. Distrust of doctors is at an ever-increasing high. Patients are more and more seeking natural methods of healing, which doctors are not trained in. So as a doctor, that can be an incredibly frustrating experience. Now, as far as the doctor side of things, that can increase their burnout. Doctors have gone from almost deity status to being questioned, disrespected, and even physically assaulted in some cases. There's actually a huge rise in that currently. Then comes insurance. There is a whole movement of physicians and other providers moving away from the insurance model. They are realizing more and more that insurance does not have their patients' best interest at heart, and it is causing all kinds of issues. All right, so all of these listed issues that we've talked about here have compounded and made mental health among healthcare professionals plummet. We are seeing suicide, stress-related illness, and despair like never before, and patients are feeling it all and watching it all unfold, which as a patient, of course, is going to make you more leery. It's going to make you more cautious about your care and honestly being honest with your medical team. Now, from a medical standpoint, one thing that happened last week is in the news, there was a news story called A Letter to My Abuser. It was a highlighted piece of a nurse that had actually committed suicide. They say that nurses are twice as likely to commit suicide than the average public. This particular article was about a nurse who had ended her life because of the issues she faced in the facility she worked at. There are current healthcare workers on strike, a lot of them nurses, being caused by the same issues that led to this nurse's death. Really, when you combine all of these things together and, you look at healthcare, allopathic healthcare in hospitals and clinic facilities that are owned by large corporations, it's really no surprise that we are seeing a huge movement into cash pay private practices. Because honestly, you can't really get your patient the proper care without doing that. So that is really why I believe, even though the statistics say that it's declining, I am seeing more and more doctors, more and more nurses, and more providers decide that they're going to go into private practice cash pay. And maybe that's why it's not registering. Maybe they don't count the cash pay physicians in that number. But I personally believe that despite the statistics, it's clear that private practice is on the rise, and for a very good reason. I think this is going to really transform healthcare and make it better for our patients and for our healthcare workers. All right, don't forget, at Cure It Systems, we help you document it, delegate it, and get it done so you can minimize risk and maximize productivity.